Hello, my name is Brian Thatcher. I'm a student nurse at Cedar Crest College, here to present my talking poster. The title of my poster is Bedside Nurse Report and Patient Safety. I chose this topic for where I work at the hospital. I see many nurses give shift report outside of the nurse's station and away from the patient. And often when they go back in to do their assessments and check on the patient, they find that the patient's in a different state than what they got in report. The IV lines may not be changed, the patient's in a different distress situation or what have you, or possibly, could be crawling out of bed. So it was just wondering if they gave report inside of the bedside, would it be more beneficial to the patients for safety? So the significance of the problem, obviously, is that nurses' main goal is patient safety, and this occurs a lot in the hospital setting. There are 63% of the 2.8 nurses work in a hospital setting, according to Groves et al. Two of the processes that nurses could use to keep patients safe are handoff report and shift report. These are the two that help improve patient safety in the United States. Gregory et al. Traditional nurse report is given mainly at the nurse's station or at a conference table away from the patient. And it's here at this time where patients are at an alone time. And it is at this alone time that a lot of sentient or events that occur that lead to either death or harm to the patient occur. So patients, if nurses were to give report during shift change in the bedside, these patients won't be alone and we can reduce the sentient events. Some of the things that are included in the handoff report are patient diagnosis, procedures performed, patient care, and what the nurses could ask the doctors during rounds. So it's very significant to do bedside shift report during in the patient's room. The process of literature search, I used Cressman Library online. I used the databases of EBSCOhost and Cinehall, and I also used Google Scholar. I used keywords such as bedside, shift, report, patient, and safety. I limited it down to link to full text between 2010 and 2018. The articles must be in English and US and also peer reviewed. After a strong analysis of the articles and ones that closely answered my PICO question, I narrowed it down to 8 articles, and from those, 3 were chosen that directly answered my PICO question. My PICO question is, in hospitalized patients, does bedside nurse report compared to non-bedside nurse report increase patient safety during shift change? As you can see, the sense of the evidence, we're taking 3 articles from Gregory et al., McAllen et al., and Williams. And here we discussed the purpose of the article, we discussed the methods, the variables, the measures of how they acquire their data, the results, the limitations of each article, the ratings of each article, and then the recommendations provided by the authors, by the research. So the recommendations for practice mainly dealt with post-implementation of a bedside shift report. So the recommendations included assessing the attitudes of nurses before and after to show that if a boost, as to say, is needed halfway through to keep nurses on pace to uphold the bedside shift report. The research showed that it works, and that if nurses were to maintain that process by a boost of encouragement, it would be better beneficial for implementing bedside shift report. Also, if the nurses would share success stories with one another of how bedside shift report helped prevent a patient from falling, or caught a patient during a distressful situation, they were able to save him because they were doing report at the bedside. Those will help maintain bedside shift report. Also, that the leadership needs to take an active role in stating that this is the new policy and that nurses shouldn't go back to a traditional nurse report because the evidence shows that it does increase patient safety. Conclusion is that bedside shift report reduces falls, reduces med errors, and increases communication between nurses, and between two nurses and also nurses and patients. Traditional bedside nurse report also not only decreases falls but increases nurse and patient satisfaction. And bedside nurse report, although is used in most hospitals, the evidence is still needed. Research needs to be shown about whether to make it standardized throughout healthcare wide, or each hospital should come up with their own bedside nurse report. So that what still needs to be studied. Thank you for listening to my presentation, and I look forward to your comments. Thank you.